Hello, and welcome. Today, we're going to talk about a common breastfeeding challenge, a shallow latch. If your baby isn't latching deeply, you may notice discomfort, nipple pain, or even slow weight gain in your baby. But don't worry, there are ways to fix it. First, let's understand what a shallow latch is. A shallow latch happens when your baby only takes the nipple into their mouth, rather than a good portion of the areola. This can lead to sore nipples and ineffective milk transfer. Recognizing a shallow latch is the first step to solving the problem. Signs include clicking sounds, your baby's lips not flaring outward, or the nipple appearing flattened or pinched after feeding. Now, let's move to practical steps to correct it. Start by ensuring your baby is in the right position. Positions like the cradle hold, cross-cradle hold, football hold, or side lying can help. Each position offers better control and alignment for both you and your baby. Make sure your baby's head, neck, and body are aligned. Your baby should be facing you with their nose in line with your nipple. Before attempting to latch, support your breast comfortably with your hand in a C or U shape. This helps guide the nipple towards your baby's nose. Gently tickle your baby's upper lip with your nipple to encourage a wide open mouth. Wait for that big, gaping mouth before bringing your baby onto your breast. When latching, aim for the baby's chin to touch your breast first, then the nose. This allows them to take more of the areola into their mouth. Make sure the lips are flanged outward like a fish, not tucked in. You should feel a firm but comfortable pull, not pinching or sharp pain. If the latch is still shallow, try breaking the suction gently by inserting a clean finger into the corner of the baby's mouth and re-latching. It might take a few attempts, and that's okay. Persistence is key. Also, keep your baby calm and relaxed. Sometimes a sleepy or fussy baby can make latching more difficult. Finally, consider seeking help from a lactation consultant if problems persist. They can provide hands-on guidance and personalized tips. Remember, fixing a shallow latch not only prevents nipple pain but also ensures your baby gets enough milk for healthy growth. With patience and practice, a proper latch is achievable. Keep trying, stay relaxed, and celebrate small successes. Your breastfeeding journey is unique, and every improvement counts. Thank you for watching. Don't forget to like, share, and subscribe for more breastfeeding tips.